Okay. Did you know that thyroid cancer is the 5th most frequently diagnosed cancer in women? And that they are 4 times more likely to be diagnosed in comparison to men? Although it's not the most common type of cancer, it is considered very dangerous because of its ability to spread and impact vital organs. There are lots of different kinds of thyroid cancers. The one that I'll be looking at is called differentiated thyroid cancer, which is a type of cancer in which the malignant cells look very similar to the benign thyroid cells. Malignant meaning cancer cell, and benign meaning non-cancer cells. Now I'd like to point your attention to my slide. In the far corner, I have 2 images up. The top one is a benign thyroid nodule, whereas the bottom one is a malignant thyroid nodule. As you can see, the only difference between the two is that vascular invasion in the malignant one. That means it's the spread of the tumor beyond its boundary. This is the reason why all thyroid cancer patients must undergo a diagnostic surgery called a thyroid lobectomy, which is only performed to see if the tumor is benign or cancerous. That's 6,000 Canadians and 43,000 Americans that undergo this avoidable surgery each year. And 38,000 of those cases are actually women. And as with any other surgery, it also poses a lot of surgical risk, such as bleeding, infection, and damage to the thyroid gland. Furthermore, the time that it takes for patients to undergo this avoidable surgery also increases their cancer risk from 15 to 30%. That's a significant amount. I'll be working to find a solution to identify the different thyroid tumor types in a timely manner to avoid the progression of cancer and surgery. I'll be doing so by looking at the 2 most popular kinds of thyroid cancer, papillary and follicular. Together, they account for 90% of all thyroid cancer cases. I'll be doing so by studying a gene panel with mutations in them through next-generation sequencing, which could serve as a predictive test for thyroid cancer. My research will fill the knowledge gaps that clinicians need to develop a simple test that would allow them to appropriately adjust treatment options. This will help prevent the loss of resources, loss of physicians' time, any negative impact on the patient's well-being, as well as increase survivability. This is my small contribution to fighting cancer. Let's beat cancer together. Thank you.